People who are addicted to drugs or alcohol may realize they need help and never reach out to anyone. The common denominator is fear. I spoke with Dr. Teresa Garati to find out what causes hesitancy and how we can break the stigma of addiction recovery.
You know, I think people think that they can just quit cold turkey, and you know, maybe some can, but depending on how long you've been using, what kind of substances you've been using, your body gets used to that, right? That's why it's an addiction, and that's why it has such a physical effect when you stop. And so we don't recommend people with a detox on their own, right? Like sometimes we get calls from families say, you know, my child is home with me and he's detoxing on his own. That's not a good idea. You really need to be in a treatment facility when you're going to do that, because your body will go through withdrawal and it'll be physically painful.
Yeah. So withdrawal aside, too, there's such a stigma with going to rehab, to recovery, to any of that. Is that one of the excuses that people make for not getting themselves into treatment?
Yeah, I wouldn't say it's an excuse.
Okay.
I think it's a real feeling of fear. You know, again, you know, I've said many times, we say all the time, it's a disease of the brain. So with any disease, people are a little bit scared. You don't know what's going to happen. But also the stigma and the shame that comes with it. You know, people feel like they're going to be judged or that they have a choice. So the more that we can talk about it, the more that you can support those that you love who are going through this, the better it will be for them to be able to actually identify treatment and then accept treatment and help as well.
And is there a definite difference in a person who needs in-house treatment versus out-of-house treatment?
Absolutely, and we do, you know, we call that inpatient or residential, inpatient, outpatient, virtual. We can do virtual programming too, but most people, if you've been using substances for a long time, will need a residential level of treatment. But in the intake process, we do an assessment, and both, you know, physical as well as psychosocial, and we determine what level of treatment is appropriate for the level of your addiction, just like any disease, right? So if you have stage 1 breast cancer, this is the treatment. If you have stage 4, so that is part of the intake and the assessment process.
Are companies getting any better with encouraging, you know, their employees if they have a problem? Because I know a lot of people are probably afraid to go because of job loss or something like that.
Absolutely. So there are protections. Obviously, employers can't discriminate based on race, gender, ethnicity, and disability. You know, and mental illness is a disability. Substance use, if you're in treatment and you're going through that, is also you know, recognized as a disability. So there's definitely protections, but people are scared. You know, some jobs, if you get drug tested, you lose your job. You know, if you're operating machinery, if you're a laborer, if you work for an airline. I mean, there's a lot of employers where it's a zero tolerance. So actually, some of those employers sometimes are a little better because they want their staff person to access treatment before there's a problem, because once there's a problem, you know, they're going to probably not be able to work in that until they get treatment. But I think companies are definitely getting better. I think we have all been talking about this now for some time, and so I think the more conversations that we have, the more that employers realize, and also employers need to realize that this is costing them money, right? So every time that they have an employee who's, you know, maybe like what we call a functional alcoholic, right? So they get to work or whatever, their productivity level is still impacted.
Right.
And there are studies that, you know, have been proven that it costs employers money. So the more that employers can encourage their employees to access their EAP programs, centers like Gateway Foundation or others, the better, I think, for everybody.
If somebody gets themselves into rehab and they get on the straight and narrow, what are the chances of a relapse?
That's a really great question. You know, I think for everybody it's different.
Okay.
And you know, recidivism and relapse, so we think about like going back. So most people, a lot of people who go through treatment say, I've heard from alums, it took me a couple times, twice, or it took me 3 times. Some, it's, you know, the first time, and they can do it. I think also the field has changed a lot. You know, years before, people could stay in treatment for a really long time. They could stay at a residential facility 3-4 months, and so the longer you can stay in treatment and the more support you have, the better. Now, because of insurance companies and just how things are, we're getting less and less time in residential. And so that also impacts whether people relapse and have to come back. Recovery supports and making sure that once they leave active treatment, and that's, you know, Gateway, once you leave residential, we are your partner for life. So we say, you know, we have an app, we have recovery housing, we have wraparound support services, so they can stay with our alumni supports. And the more we do that, then the less the relapse.
All right, if you or someone you know is struggling with addiction, you can reach out to Gateway Foundation. The information is right there on your screen.